Hello, guys. Welcome back to another nursing stories with mistakes you should never make. Okay, today I'm going to tell you a story about a nursing assistant that was fired because of.
Ìwọ ni ọ̀rọ̀ tí ń gbé nínú ọmọ ènìyàn fọ́hùn. Ìwọ ni àdúró tì ní lọ́jọ́ ewúle kòkó. Ìbà o, ìbà o.
I'm going to give you, as usual, a little backstory about this nursing assistant. This stories, again, is to show you the mistakes that you should never make and how these mistakes progress to a point where these people were fired. There is always a warning sign. There is always, some telltale signs that lead to this. It's usually because of things that they refuse to correct, behaviors that they refuse to correct that leads to this big issue. Because who doesn't know that if you keep doing the same thing over and over again, you keep making the same mistakes and keep trying to hide it, one day it will catch up on you. Same thing in life, same thing in nursing. This nursing assistant, she was one of those that liked to work by herself. She will come in and she will just work by herself. She will not ask for help. She will just do things on her own, and most of them were incorrect. She always used to give medication, especially blood pressure medication, without checking the blood pressure. We all know, as a nurse or a medical tech, in the morning before you give your patient, especially blood pressure medication, one of the protocol is that you have to check their blood pressure before administering that medication to them. She'll have the blood pressure cuff there on her cart, but she will not do the blood pressure. She will make up those blood pressures and she will put them there and she will administer those blood pressure. One time she gave one of my patients her blood pressure medication, and because her blood pressure was already low, it dropped her blood pressure further. The patient was dizzy, the patient was so hypertensive. I had to give this woman IV fluid to bring back her blood pressure. And I had a very long conversation with her that day. I tried to re-educate her and let her know that it's very crucial. This is about people's life that you're dealing with. You have to do the patient's blood pressure. And then I also used to notice that she will go pick up a patient that was a Hoyer lift patient. A Hoyer lift is an equipment that is used to lift patients that are too heavy to be lifted by two people. When someone requires a Hoyer lift, that means they are a certain pound, usually over 200 pounds, that it is not safe for an employee's back for that patient to be lifted, especially if that patient cannot assist you in moving from the chair to the bed or from the bed to the chair. So these are equipment that are designed to make your work easy. So it means that you're going to need two people to help you. The Hoyer lift has to be used by two people. Okay, so you need two people to bring this person out of the bed. So most times she will use this lift by herself. Sometimes this particular patient, she will always try to move this patient from the chair or from the bed to the chair by herself. I remember having this conversation, and this also was a moment that taught me that words are very, very powerful. We should be very careful about the things we say and the things that we do. Especially when I noticed that she was doing these things, most times as a nurse on the floor, I will be the one to go and help her. So she will call me to help her, or she would try to do these things by herself. And I remember having this conversation with her, and I told her, I'm just going to call her Lizzie. Her name wasn't Lizzie, but I'm just going to say Lizzie. And I told her, Lizzie, you need to learn how to work with your fellow medical assistants or nursing assistants. You cannot work by yourself. I am not always going to be working with you. And one day something will happen, and unfortunately for you, I will not be here to help you. I was saying it to kind of help her see what I'm trying to say to her, how serious this is, that she needs help and she cannot do this by herself. And unfortunately, my words came true. That day I was supposed to be at work, and unfortunately I could not go to work that day. So I took an excuse and I called off. I wasn't at work. And apparently she went to lift this patient out of the bed, and this patient fell off the chair. This patient fell off the bed. And what she did was she assisted this patient back to bed and never said a word. What happened was I was supposed to do morning and evening shift that day. So I called off the morning and I went for the evening. I used to work mostly over the weekends, and I will do like one day during the week, and I'll do like Saturday, what is called double shift, so morning and evening. So that day I took off the morning and I went in the evening. So this thing happened in the morning. And of course, being a nurse that has been burnt several times, I learned, and this is why I'm giving you these stories, I learned to always do my rounds. So I was doing my rounds, right? I went in room by room. So I went to this patient's room, and this is 3 o'clock, right? Usually she's in bed. Usually she's up in the chair, and she was still in bed at 3 o'clock. I was like, why is she in bed? She's supposed to be up. So I checked her and I touched her. Soon as I touched her, she screamed. I was like, something is wrong. I tried to move her. She yelled. And then I called the other nurse. I said, let's check this lady. So we turned her. She screamed. Her hip was swollen and red. I had to call 911 and send her to the hospital. We later found out that she had a fracture. Now, how did this woman have a fracture? And I was transitioning out of that. I was still working for the same company, but I was transitioning as an LPN because, like I said, I was in school. So I had finished my school, but I was still maintaining that shift. So I was transitioning out of that particular building as a bedside nurse, as an LPN, to a wound nurse for the same company, but I'm going to a different building now to work as a wound nurse. So I was transitioning out of this. So that was the weekend. The following Monday, I was supposed to start at my new position, right? The following week, I was supposed to start as a wound nurse at a new location. So of course I had to do an incident report, and I'm like, so I asked the nurse what happened. She doesn't know what happened. The nursing assistant did not tell her anything about this patient. There was no complaint, blah, blah, blah. Okay, so I did my incident report. I did my everything. I put it. So of course I went to the other building and started working, and they were doing their investigation. They were still calling me over there for, my own version of the story. So come to find out that this lady fell. This lady fell, and she picked up this lady. As usual, doing things by herself, she tried to help the lady. The lady fell. She picked up that woman, put that woman back in bed. She did not know that that woman had sustained a fracture from that fall. That woman ended up having surgery for that fracture, and she was fired. Again, I go back to this thing. Do not make these mistakes. A tree cannot stand alone and form a forest. You need people in such an environment. You have to be a team player. You have to work with people. I was working with her. I was someone that she could trust, but I always used to tell her, you have to work with other people. You have to work with your co-workers. You can't just come and not talk to people, and you can't just come and just try to do things on your own. It will backfire on you one day. And that's exactly what happened. So don't be like Lizzie. Till the next story. Bye.
Ìwọ ni ọ̀rọ̀ tí ń gbé nínú ọmọ ènìyàn fọ́hùn. Ìwọ ni àdúró tì ní lọ́jọ́ ewu le koko. Ìbà o.